you?
Yeah, sure.
Let's take a look.
In this section, you will learn how to treat common muscle, bone, and joint injuries, including fractures, dislocations, sprains, and strains. Sometimes it's not easy to tell the difference between them, but an exact diagnosis isn't important when giving first aid because we'll treat most of them the same. A fracture is a break in a bone produced by excessive strain or force. A dislocation is a separation of bones joined at a joint. Treat a dislocation the same as a fracture. Some things to look for are deformity, angulation or shortening, tenderness or pain, open wound or exposed bone ends, swelling, bruising, numbness, bleeding, inability to use the injured part, crepitus or a crackling sound with movement, a snap or pop sound heard at the time of injury. To treat for a suspected fracture or dislocation, first use scene safety. Call 911, get the first aid kit, and put on personal protective equipment. Keep the victim calm and still. If needed, cover open wounds with a sterile dressing. Apply gentle pressure to control bleeding if needed. Do not press directly onto any exposed bone ends. Applying an ice pack wrapped in a damp cloth will reduce pain, swelling, and bruising. Apply ice packs no more than 20 minutes at a time. Monitor temperature and sensation beyond the injury site. Do not try to move a victim with a suspected fracture unless it's absolutely necessary. Only splint the injury if emergency response is delayed or if you decide to transport the victim yourself for a minor injury or from a remote location. Applying a splint reduces the movement of injured muscles and bones and allows transport with less pain and risk of further injury. Splints are applied to suspected fractures, dislocations, and severe sprains to immobilize the joints above and below the injury. To splint a suspected fracture, explain the procedure to the victim. Check temperature and sensation below the injury site. Select an appropriate splint that is longer than the bone it will support and pad it if needed. Carefully splint the injury and secure it in place with tape or binding above and below the injury site. Recheck temperature and sensation below the injury site and adjust as needed. A splint should be snug to offer support and pain relief, but not so tight that it restricts blood flow. A contusion or bruise is caused when blood vessels are damaged. A sprain or strain occurs when a muscle or joint is stretched beyond its normal range of motion. Ankle injuries are the most common. Signs and symptoms of a sprain or strain are similar to those of a fracture. If an injury remains swollen and painful for several days, consult a physician. Use the RICE technique to treat a possible sprain or strain. R. Rest. Stop activity after an injury. Do not put weight on the injured area. I. Ice. Apply an ice pack wrapped in a thin, damp cloth to the affected area to reduce swelling and pain. Apply the ice 20 minutes on and at least 20 minutes off several times a day for the first 2 to 3 days. Do not apply ice directly onto bare skin because it can cause frostbite. C. Compression. Wrap an elastic bandage around the injury to reduce swelling, working upward. Apply the wrap snugly but not so tightly that the person loses feeling beyond the injury. Wrap in a spiral overlapping with each turn. E. Elevate. Raise the injured area above the heart if it does not increase the pain. This decreases blood flow to the area, reducing swelling and bruising.